Neuroanatomy and a profound knowledge of neuroanatomy will always help you in neurology, in neurosurgery, and it's quite mathematical. This neuroanatomy is quite different from other branches of anatomy because here your knowledge, in absence of any hi-fi diagnostic techniques like the PET, like the MRI, like the CT scan, your knowledge of neuroanatomy will immensely and precisely help in localizing the lesion. So I will be going across a few cases over here, the importance, the mathematics of neuroanatomy, though medical and mathematics has got no correlation, but over here it is a significant correlation. And you will come to know after a short period of time why, and I hope that you will be finding this very interesting. So as far as the importance of images in neurology and neurosurgery is concerned, profound, because images are one thing which are more receptive to memory. And in case you read a lot of content and then you have an image on the other side, the recap of the image is more profound and more everlasting, and it keeps the the imprints on your brain for a long period of time. So every student should just have the realization of the importance of images as far as reading is concerned, any subject, be it any subject. And it is important that what happens, there's an image acquisition which occurs in the brain, then there's a processing, and then once you add it up with the writing description, you integrate all the things that adds up your memory. So first thing, the first slides over here, you can see that it is just simply corpus callosum. And who does not know corpus callosum? So it is a commissural fiber, and you know that it connects the right and the left cerebral hemispheres, and it is interhemispheric. And what is important? The motor, the sensory, and the cognitive functions of the both lobes of the cerebrum are integrated by corpus callosum. And this is an important fiber. Now you will have sometimes a patient, a neonate, a child presenting after a lag of time with incoordination of movement, incoordination of activities. There will be high level of imbalance of the movement. There will be not a coordination between right and left cerebral hemispheres. And this is the what we say, the corpus callosum agenesis syndromes. And there are so many syndromic entities in which there can be delayed development or totally absence of the corpus callosum, as a result of which, depending upon the severity of the fiber loss between the two cerebral hemispheres, a patient will have neurological defects ranging from mild, moderate to severe. And you can see that there are these entities. Say you are well aware of Dandy-Walker syndrome, WK syndrome. So the Dandy-Walker syndrome, you know, in addition to there is this Anderman syndrome, and there is this Aicardi syndrome, in which there is the absence of corpus callosum. So these are corpus callosum agenesis or hypogenetic syndromes, and that is very important. So corpus callosum fibers you read in detail, but I'm not going into the anatomy of it. So you are well aware that corpus callosum has a role in coordination. Now after that, we go to the next, amygdaloid nucleus. A patient might be presenting with you with rage, with emotional disturbance, with hyperorality. That means he takes everything towards his mouth, his or her mouth, with hypersexuality, abnormal sexual behavior, increased sexual promiscuity, and then in addition to that, loss of fear, loss of anger, inappropriate conduct. And this is something wherein this temporal lobe comes into being, and there is this nucleus, the amygdaloid nucleus. And the lesion of the amygdaloid nucleus causes Clover-Bursey syndrome. And what is the importance? The importance lies in the fact of knowing this nucleus and the lesions which occur as a result of whether we mentioned the corpus callosum in the previous case or whether we mentioned amygdaloid nucleus in this case. So there are these features which are as a result of, there is no need to do an MRI, CT, or a PET once a patient presents to you with such clinical symptomatology. You have to have the knowledge of neuroanatomy, and that will determine the lesion, the site of the lesion precisely. So the next thing, paralysis agitans. And this image over here, you can see that there's the paralysis agitans. Many of the people do not know that it's the same name for Parkinson's disease. And you are well aware of Parkinson's disease with mask-like expressionless faces, saliva drooling from the corner of the mouth, bent posture, shuffling gait, pill rolling tremor, 4 to 6 hertz. And these are features as a result of what? Substantia nigra. Substantia, substance, nigra, bluish or brownish or bluish brown. This is a nucleus. And then the problem occurs as a result of loss of dopaminergic neurons in the substantia nigra. So paralysis agitans is a result of the nucleus, degeneration of the nucleus as a result of excessive apoptosis or many other factors in this case. So you know that the patient is having Parkinson's disease. The most likely site of lesion is the substantia nigra. It is not the red nucleus. It is not the occipital lobe. It is not the vermis. This is the importance of knowing the neuroanatomical structures. So going ahead, we have got sometimes a patient presents usually with loss of smell, and then once you do a scan, it shows a benign lesion in the frontal lobe, on the inferior surface of the frontal lobe, and you are well aware of this thing: the olfactory tract, the olfactory bulb, the medial olfactory stria, the lateral olfactory stria. And what is it? It is usually a meningioma compressing the olfactory bulb, as a result of which the pathway, the olfactory pathway is, disturbed, is blocked, and then the patient loses the ability to of olfaction, of smell. So partly or completely, in case it depends upon the size of the lesion, the compression of the pathways, the olfactory pathways. So in case a patient presents and there's your scan sometimes shows, so there's no other point. The location is the inferior of the frontal lobe of the brain. So that is the way you understand neuroanatomy and neurosurgery and the applied concepts. So after that, now important and very interesting, lentiform nucleus. You are well aware of this copper deposition syndrome, which we give the name as Wilson's disease in medicine. And what is Wilson's disease? The alternative name of Wilson's disease is hepatolenticular degeneration. Why? Because hepato refers to the liver, lenticular refers to this thing, the lentiform nucleus. Many of the people don't know it. So because of the copper deposition, the excessive copper deposition within the liver, a patient will be having hepatomegaly, and maybe due to degeneration or the copper deposition within the lentiform nucleus, a patient presents with tremors, a patient presents with muscular stiffness, a patient presents with dysarthria, and in the this histological place, the Descemet's membrane, casal flesher rings, and so much. So many sensory changes and all those things. But important thing is that this Wilson's disease, also named as hepatolenticular degeneration, takes its name from the fact that the liver, in addition to the lentiform nucleus, is also affected. The lentiform nucleus, which is a biconvex lens-shaped nucleus, a part of the basal ganglia, which you are well aware. So this causes movement disturbances. This causes, a patient to present with all these muscular rigidity, tremors, and muscular incoordination. So that is something about the lentiform nucleus. So what is it? Basically, it implies the core basic knowledge of neuroanatomy you have, and then once you apply it to the branches, the medicine, especially neurology, so you will be a good student of medicine once you are a good student of neuroanatomy. Now, you ask the patient to protrude his tongue out. So there is the slide of the tongue protruded and deviated to the right side. And that is just simple, the right hypoglossal nerve palsy. And you know that the deviation of the tongue is ipsilateral towards the side of the paralysis of the nerve. So the right side hypoglossal nerve paralysis is called deviation of the tongue to the right side, and the left side hypoglossal nerve palsy will cause the deviation towards the left side. So these are important basic, say neuroanatomical concepts which you apply in your neurology. Now, the important part of the hindbrain, the cerebellum, and the cerebellum, especially vermis, concerned with the coordination of the movements. And the cerebellum, you have these things. You cannot do rapidly performing tasks, dysadiadochokinesia, the nystagmus, which occurs involuntary. You cannot perform the tandem test. You cannot perform the finger nose test. So what is there? This is the cerebellar syndrome. These are all the components of cerebellar syndrome. Dysadiadochokinesia, intention tremor, then nystagmus, then inability to do a tandem walk test, then inability to do the finger nose test, because cerebellum is concerned. It is one organ which is neither motor nor sensory, and it is concerned with the coordination of movements. So that is why cerebellar syndrome especially presents with dissociation of movements which are not highly coordinated. So this is how now what you notice over here, this is a clicking time bomb. Sometimes you notice in a young patient who is not hypertensive at all, you notice in him or her severe thunderclap headache, the worst headache of the times without being hypertensive. And then after few, moments or within hours, patient collapses. And this, you do a CT scan and it shows blood in the subarachnoid space. Why? Because of a rupture of an aneurysm. Especially these aneurysms are the dilatations of the vessel walls and they rupture, especially in the circle of Willis. And where in the circle of Willis? The anterior circulation. 90% of the aneurysms rupture or bleed in the anterior circulation. So they can cause a catastrophic event. So most likely death, or some people who survive this are being done with aneurysmal clipping, and then this is subarachnoid hemorrhage. So this is an aneurysm over here, and you have to know the profound knowledge of neuroanatomy will help you in neurosurgical, diagnosis. So this is something which I just wanted to emphasize upon you. The terminology in neuroanatomy, it is vast. There are so many new terms in neuroanatomy, and you have to be acquainted with these terms. What we mean by a peduncle, what we mean by a cistern, what we mean by a fasciculus, what we mean by a bundle, what we mean by a nucleus, what we mean by convergent snaps, what we mean by divergent snaps. So much of a confusing terminology. So, but you have to be very well acquainted with your knowledge of neuroanatomy, and that will help you a lot. And I hope that this interesting case scenario collection and the manner in which I just presented it in simple terms will help you a lot. Thanks a lot.